Assalamualaikum and welcome into 13th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into 13th match, that is between Services Masters and Dow Elite Warriors. It's again a crucial match because it is also a knockdown match. We have already qualified 4 teams from Group A, B, C and D for Super 6 stage. Name 𝐏𝐚𝐤𝐬𝐬𝐿 Invincibles, JPMC Tigers, LUM Strikers and LNH Galaxians. Today we are blessed with the kind presence of Professor Azizur Rahman Saab. He would be umpire of today's match. He is Professor of Medicine and Senior Vice President of PSIM. Along with him we have with us Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Saab. He is moderator of today's session. He is Assistant Professor of Cardiology and Stroke Interventionist at RIC Rawalpindi. For further moderation, over to Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Saab.
Thank you very much, Usman. So we are back again with another iteration, another match of this outstanding, amazing first season of Cardiometabolic Premier League, which is brought to you in collaboration with Wilson's Pharmaceutical and Pakistan Society of Internal Medicine. So I'm always there with you. Today, I've had to join remotely due to some unforeseen circumstances, but as we know, the show must go on. And it's great to have the two teams. I know it's always an exciting match when we are talking about this amazing Premier League. And today we have two teams that are up against each other. So we have Services Masters going up against Dow Elite Warriors. And I'm sure it's going to be a wonderful match. We all know these days it's all about masters and warriors. As we know, that's what's going on. But I'm sure one of you is definitely going to get through, but the other team is also going to take a lot home. With this, I now have the honors of moving towards our panel of experts. And right now, I can only see quite visible our shining star. It is our umpire of all the matches that we've had, the evergreen, the ever vigilant, and the ever so amazing. We have Professor Azizur Rahman Saab. Sir, so you finally made it.
Yes, I did.
So it's great to have you. And I think we'll have more introductions as we have more people coming in. Now, the thing which is important is the match that we have in hand today. So according to the format of the game, I'm going to ask the captains of both the teams to come up with the introductions of their respective teams. So I think we'll first start with Services Masters. Can we have the introductions, please?
Dr. Sanaullah.
Dr. Numan Safdar from Services.
Dr. Hafiz Ehsan from Services.
Dr. Fiyaz from Services.
All right. So welcome to the match and best of luck to you.
Thank you,
Now,
sir.
can we have the focus on the next team? Dow Elite Warriors, that is the captain, to go ahead with the introductions.
I am Dr. Uzma Abid from Dow University Hospital, Karachi.
Introduce your team, please.
Dr.
Okay.
Lajpat Singh, Dow University Hospital.
Dr. Hafiz Rafe from Dow University Hospital.
Dr. Zishan Sami Khan.
All right. So with this, we have the introductions from both the teams. So best of luck to you as well. I hope we are going to have a good match today. So as always, what are the conditions like? So I think it's quite hot, as we all know. Temperatures are scorching at the moment. I do see some humidity, so I'm expecting a bit of movement in the pitch today. But I also hope that we're going to have a pretty high score. All right. So with this, do we have the next stage? That is the coin toss ready. Can we have it on the screen, please? So it's going to be an electronic coin toss. And I'm just going to randomly ask one of the teams, Dow Elite Warriors, do you want heads or tails?
Tails.
So they want tails. Please roll the coin. And it's a tails. Well done. That's a good start, Dow. Warriors have actually won the toss. And according to the format, services, masters, don't worry, it's just the toss. So I'm going to pose you with two questions. The first one, Warriors, whether you want to take the questions or you want to throw the questions.
Throw the question.
You want to throw the questions. All right. Now, the second part, the second question, you will have two scenarios in front of you, scenario A and scenario B. Which one do you want to pick? You can pick anyone. Nobody knows what's there, not even you. Come on, Warriors. Just pick one.
Case A.
Okay, so they have picked A. So the news from the center is it is Dow Elite Warriors who have actually won the toss. They want to throw the questions and they have selected case A. All right. Sir, do we have the permission to start the game?
Please,
Aziz Saab.
go ahead.
All right, so we are going to start the game. Can we have the first case on the screen, please? And I will request Dow Elite Warriors to read the scenario now.
50-year-old male presented to OPD with a complaint of cough pain after walking a few steps for past 1 month. He is a known diabetic for 15 years. He is a non-smoker. On examination, there are the diminished pulses in the lower extremities.
All right, so you can take a couple of seconds to gather yourselves and you can let me know, masters, when you're ready. So are you ready for the first question?
Yes, sure.
Can we have it on the screen? That's on the screen. Warriors, read the question along with the options.
What is the most likely diagnosis? Option A, Berger disease. B, obstructive microangiopathy. C, peripheral arterial disease. D, Raynaud syndrome. E, diabetic neuropathy.
And your 60 seconds start now.
So we'll be going with the option C, peripheral arterial disease.
Are you sure about it?
Yes, sir.
You want to go ahead with option C, C Charlie, right?
Yes, sir.
Okay, so we are going to lock option C Charlie. Let's see. And yes, start off with a 6. Very well played. So you've taken the full toss, hit it straight over the bowler's head, and that's a huge 6. And that's the kind of start we always enjoy. Wonderful. Good start. So can we have question number 2 on the screen, please? Read it, Warriors.
Which of the following non-invasive tests is the most sensitive in detecting the peripheral arterial disease in the diabetes mellitus? Ankle brachial index, Doppler ultrasound, duplex ultrasonography, MRA, and the CT with the contrast.
And your timer starts now, 60 seconds on your screen. It's a short pitch delivery. Let's see how well they can pull it. "25 seconds.
So we'll be going with the option A, ankle brachial index.
Are you sure? Option A, alpha, right?
Yes, sir. Yes, sir.
Okay, so we are going to lock option A, alpha. Lock it. And yes, that's another one. And that's what we were hoping for. Nicely pulled for another 6. So that's 2 in a row. Very well done. Very well played. And I will request you to keep your mics open when you're discussing, because it's the discussion which actually is quite enjoyable for all of us. Right. Question number 3. On your screen, please. Read it.
What is the primary pathophysiology link between the diabetes mellitus and the peripheral arterial disease? Option A, hyperinsulinemia leading to thrombocytosis. Option B, insulin deficiency causing the endothelial hyperplasia. Option C, chronic hyperglycemia leading to endothelial dysfunction and atherosclerosis. Option D, glycosuria causing the vascular dehydration. Option E, immune reaction to paraproteins.
Okay, 60 seconds on your screen now.
उसमें से निकाल लेगा, अगर उसमें से पानी निकलेगा तो उसको ऑटोमेटिक तो सीधा So, sir, we're going with option C, Charlie.
Okay, they've come down the bucket a bit. They want to go with option C, Charlie. Should I lock it?
Yes, sir.
Okay, they're confident. Lock C, Charlie. And yes, they're rightly confident. Very well done. So that's 3 in a row. Very well played. Wonderful going. So this one has been heaved over long on. So I think they're using the long bat pretty well. All right. With this, we move to the next question. Question number 4 on your screen.
So here's the fourth question. A patient was examined for peripheral arterial disease. There was a palar on elevation and a rubar on dependency. What is the name of this sign? This is the Burgess sign. This is the Hess sign, Tinel sign, Renard sign, Kerning sign.
60 seconds, start now. Okay, this one is moving. It's swinging in, or is it swinging away? I'm not too sure. Approaching 25 seconds. So team which is discussing, please leave your mics open. We want to hear your discussion. Yes. 15 seconds to go. Come on.
The node versus
10 seconds. Hurry up. 7.
So we'll be going with option D, Renault sign.
Okay, D Renault sign. So you want me to lock D delta? Should I lock
Yes,
it?
sir. Yes, sir.
Lock D delta. Oh, that's the first mistake. Oh, definitely the first mistake. So I told you this one is either coming in or moving out. So never mind. That's the first mistake. You've already had a wonderful start. So gear up for the next question, which is question number 5 on your screen.
So in the diabetic patient with a critical limb ischemia, which of the following treatment strategies has the best long-term limb salvage rate? Anti-platelet monotherapy, supervised exercise therapy, endovascular revascularization, oral vasodilator, and statin.
Timer starts now.
Yeah, उसमें antiplatelet का ये है ना
So
कि
the
वो
ball is definitely moving a bit. As per conditions, let's see.
नहीं बेस्ट लॉन्ग टर्म लेकिन वो लॉन्ग टर्म आप एंटीप्लेट देंगे ना उसको सीएलए ठीक करने के लिए कि वैस्कुलर करना है
छोटे जो लिम्ब इस्कीमिया है ना, लिम्ब इस्कीमिया के अंदर हम एंटीप्लेटलेट तो नहीं,
लेकिन है ये आर्टरी डिजीज की बात हो रही है ना, वेनस की बात नहीं।
हाँ
So we'll be going with option C, endovascular revascularization.
So you want me to lock C Charlie, right?
Yes, sir. Yes, sir.
Okay, they are sure about it. Let's
Yes, sir.
lock C Charlie. And yes, very well done. This is a wonderful answer. And I was just hoping for the right one, and you pulled it off. Very well done. That's a wonderful start again. I think you're moving in the right direction, and you may just end up scoring a big one, which is going to be pretty good to see. So we are all excited about this game and definitely the score that we are looking at, the projected score. Let's see where we end up. Question number 6 on your screen.
Which of the following is a independent predictor of poor outcome in the diabetic patient undergoing the lower extremity revascularization for peripheral arterial disease? Duration of diabetes less than 5 years, age more than 40, presence of neuropathy, use of metformin, age more than 75.
And your timer starts now.
अगर न्यूरोपैथी होगी उसको बार बार
इंडिपेंडेंट तो नहीं है न्यूरोपैथी, वो तो डायबिटीज की वजह से ही है।
नहीं like इनमें से पूछना ना, इनमें से कौन सा इंडिपेंडेंटली like will be most harmful for the patient with bad age. तो एज नहीं वाला निकल गया। न्यूरोपैथी मेटफॉर्मिन है तो कोई ऐसा नहीं है उसके ऊपर। सी प्रेजेंस ऑफ न्यूरोपैथी के साथ ये है कि न्यूरोपैथी के साथ
25 seconds.
नहीं यार एज व्हाई नॉट एज
15 seconds. Come on, we are approaching 10 seconds now.
So we'll be going with option E, eta age more than 75.
Okay, so they want to go with E, eta, age more than 75. So the fingers are crossed. Let's see. Lock E. Oh, and the fingers were crossed rightly. You have missed your second answer. Okay, but still, I think you guys are doing a great job. I think this discussion that we had was wonderful. The way you were discussing, you were trying to decipher. I think that's what's important. The way you reach up to a conclusion, because this is what we do all our lives. When we are seeing patients, we have discussions and we are trying to find the right answer. All right, still you can score big. You still have 4 more questions to go, and we have question number 7 on the screen now.
Regarding the medical therapy for the peripheral arterial disease in the diabetic patient, which of the following statement is the most accurate? Aspirin is contraindicated in asymptomatic peripheral arterial disease. Statin should only be used if the LDL greater than 130 milligram per deciliter. Glycemic control alone is sufficient to reduce the peripheral arterial disease progression. High intensity statin are recommended regardless of LDL level. Aspirin alone will all reduce the risk of amputation.
Start the timer, please.
स्क्रीन नजर नहीं आ रही है वाली थोड़ा सा।
Okay, you can't see the screen?
Okay. Just, yeah, now we can see it.
Okay.
Aspirin won't be contraindicated, obviously. LDL will take it to the 70s. Aspirin will alone reduce the risk of amputation. No, okay, obviously we have to treat with the artery. D. So sir, we'll be going with the option of D, high intensity statins, delta.
Okay, you want me to lock D. Are you sure about it?
Yes, sir.
Okay, so they are sure. This time, I think they're trying to flick it over. And this time, I think it's going towards the square boundary. Let's see. So lock
Yes,
D,
sir.
delta. Oh, yes! Because this flick was going high out of the park. So well done. A much needed 6. What a beautiful boundary this is. Very, very well done.
3 और चाहिए.
So we are moving in the right direction, and we have question number 8 on the screen now.
What is the most common symptom of peripheral arterial disease? Rest pain, intermittent claudication, gangrene, critical limb ischemia, ulcers.
Timer starts now.
मोस्ट कॉमन सिम्टम पूछा है क्वेश्चन के अंदर भी यही था कि वो 1 मंथ से उसको चलने पे पेन हो रहा है हमेशा पेशेंट पेन के साथ आएगा ना कभी कॉम्प्लिकेशन भी ना हो
TLI भी सबको नहीं होता होगा ऑब्वियसली आर्टेरियल अल्सर्स भी लेस लाइकली होते हैं वेनस और
बाद में बन सकते हैं लेकिन मोस्ट कॉमन सिस्टम जो है ना वो तो
सही
क्वेश्चन के अंदर भी एविडेंट था कि वो क्लॉडिकेशन ही है
So, sir, we'll be going with option B, intermittent claudication.
So are you sure about it?
Yes, sir.
You want to go with option B, intermittent claudication. So lock option B, please. And yes, again, wonderfully played. This is over covers for a 6. Beautiful stroke. I think you're really demonstrating how this game should be played, how the discussion should go on. And you are, it's the way you exclude things and then you reach up to the right answer by taking into account all the team players. This is what team players and teamwork is all about. Well done. So
Yes, thank
we
you, sir.
still have 2 more questions to go. And we have the second last question of this innings on the screen. Question number 9.
What is the gold standard test for final diagnosis of peripheral arterial disease? Ankle brachial index, duplex ultrasound, magnetic resonant angiography, CT angiography, digital subtraction angiography.
60 seconds on your screen. We can't hear the discussion. Please unmute.
वैसे सिटी का इशू ये है ना सिटी का फायदा ये है कि सिटी आपको कैल्शियम स्कोर भी बता देता है आपको साथ MRA ऑब्वियसली यूजुअली बिफोर सर्जरी भी स्टार्ट टू गो होता है कि हम MRA करवा लें बट सिटी का एक एडेड बेनिफिट ये है कि वो हेल्प करता है कैल्शियम स्कोर में
25 seconds.
MR और उसमें
MR और CT में
MRA बेकार सर वी विल गोइंग विद ऑप्शन C MRA.
Okay, you want me to lock option C, Charlie?
Yes, sir.
Okay, so they are sure about it. They want me to lock C, Charlie. And I think they want to hit this one out of the park. And they seem to be quite sure. Let's see what the answer is. Lock C, Charlie. Oh, this was not the right answer. The right answer was DSA for sure. Okay. All right. So that's your third miss so far. You still have one more to go. I think this is going to be very important because this will take you above 40. 42 will be the score if you get this one right. So,
Yes.
you're all hoping for a good score. Best of luck to both the teams. Question number 10, the last one of this innings.
Which of the following risk factor has the strongest association with the peripheral arterial disease? Diabetes, hypertension, cigarette smoking, alcohol, hyperlipidemia.
Timer starts now.
एसोसिएशन सिगरेट स्मोकिंग की अब तक बढ़ी है जहाँ भी बढ़ी है इसकी
गिवन केस सिगरेट मतलब आपका सिर्फ सिगरेट रोकने से 36% मोर्टेलिटी कम हो जाती है खाली सिगरेट रोकने से ऑब्वियसली तो
मेरे ख्याल से सिगरेट स्मोकिंग ही है बाकी जहाँ 3 गलत हुए हैं
नहीं अब नहीं शाला
सिगरेट स्मोकिंग है
सो सर वी विल गो ऑप्शन विद ऑप्शन सी सिगरेट स्मोकिंग
So you want me to lock C, Charlie? You're sure about it?
Yes, sir.
Okay, so I do see a bit of Afridi in you. You've come down the wicket, going for a 6. Last ball, I would say. Okay, let's see where we end up. Lock C, Charlie. And yes, I think you got this one on the full toss. And that's definitely a 6. Very well done. You've put it out of the boundary, out of the park. And with this, we have a pretty decent score. I think just 3 misses, a score of 42. So that's very well done, well played. I think Dow Elite Warriors do have a good match on their hands. They'll have to play well. But I think, again, both the teams are going to fight it out. That's one thing for sure that we know. And with this, I now move towards our umpire, Professor Aziz Saab. He's there with all his, looks and his eyes on focus. Sir, your thoughts?
I think it was a very good match. I didn't see any ambiguity. I think all the questions were clear and they were well answered. In one of the questions, while they were discussing, they were, I think, coming up with the right answer. I don't think why at the last moment they changed their answer. So, but that happens. I think this is at least very, very transparent. It shows that they are actually discussing it and coming up with the agreed answer. So I'm really enjoying it.
Yes.
Very right, sir. I think very rightly pointed out, he's always so keen. He's picking things. And as he has said, you are going in the right direction, but then this is where the whole group comes into play. Someone has to steer it. The captain has a major role, but I think everyone is responsible there. And at times we do make mistakes. We are humans at the end of the day, and we're always learning things. We're always improving. And this show is to improve all of us, not to prove that somebody is more and someone is less. That's the aim. And I think that's what we are attaining. So with this, I think we are now going to move towards the second innings of the match. So are the teams ready?
Yes, sir.
Okay. So can we have the next scenario on the screen, please? Masters, it's your turn to read the scenario.
So at 32 years old woman, G2P1 at 26 weeks of gestation presents for a routine antenatal visit. She reports increased thirst and frequent urination. Her first pregnancy was uneventful. There is a strong family history of type 2 diabetes mellitus on this visit. Her random plasma glucose is 158 milligram per deciliter. Her BMI is 29 kilogram per meter square.
Okay, so warriors, you can take a few seconds and let us know when you're ready. Okay, so you're ready for the first question? Warriors, are you ready?
Ready.
Okay, bring the first question on. Read it,
So
masters.
first question is, what is the most appropriate next step in the evaluation of patient? Option A is repeat random glucose after 1 week, HbA1c, 75 gram oral glucose tolerance test, start metformin and fasting insulin levels.
All right, so your timer, 60 seconds on your screen now. Best of luck. So please unmute yourself, warriors. We want to hear the discussion. Warriors, we can't hear you. Unmute yourself.
Option C.
Okay, so the idea was to hear your discussion. We want to hear your discussion, so please unmute yourself while you are discussing it. So which option? Tell me again.
Option C.
Are you sure about it?
Yes, C.
C, Charlie. Okay, they are sure. They want to go for a 6. Lock C, Charlie. Oh, yes, they have come up with a 6. That's a brilliant start. Well done. Right answer. Very well played. Okay, question number 2 on your screen now.
Question number 2 is, what is the diagnostic threshold for 2-hour plasma glucose in a 75 gram OGTT in a gestational diabetes according to the IAD, DGPSG and WHO criteria? Option 1 is more than 120 milligram per deciliter. B is more than 140 milligram per deciliter. C more than 153 milligram per deciliter. Delta is more than 180 milligram per deciliter, and eta is more than or equal to 200 milligram per deciliter.
Your timer starts now. Let's see if this is a 6 or this one takes the outer edge. Warriors, unmute. We can't hear you.
Option C.
Are you sure about it? Option C.
Yes.
You want me to lock it?
Yes.
C, Charlie. Lock option C. Oh, yes. All right. So this one definitely got the good chunk of the bat and went for a 6. So well done. Very nicely answered. This could have been a bit tricky, but you played it well. All right. Moving to question number 3.
Question number 3 is, which of the following is not a known risk factor for gestational diabetes? Option A is obesity. Option B is maternal age more than 25 years. Option C is personal history of macrosomic baby. Option D is hypothyroidism. And option E is polycystic ovarian syndrome.
And your timer starts now, 60 seconds. Let's see what happens. Let's see whether we have another hat trick just at the start. Hat trick of sixes, that's what I mean.
डन करें देखें ओबेसिटी तो होता है पर्सनल हिस्ट्री और मैक्रोसोमिक में भी होगा हाइपोथायराइड में भी रिस्क होता है पॉलीसिस्टिक के साथ एसोसिएशन बी हो बी कर ऑप्शन बी
Okay, that was a quick one. Came down the wicket, and I think he's heaving it over long on. Are you sure about it?
यस सर ऑप्शन बी
Option B, beta.
यस
Okay, lock option B, beta. Oh my goodness. This one is the wrong one. So that's the first mistake we've seen from your side, and we've missed the hat trick of correct answers.
Sorry, excuse
Okay.
me, sir. We have an issue with the question number 2.
Okay.
So, question number 2 was the diagnostic threshold for gestational diabetes.
For at least 7.8 millimole per liter, which is equivalent to 140 milligram per deciliter.
The answer in the question was 153 milligram per deciliter.
We
Okay. So you're talking about the previous question.
yes,
right?
question number
Question number
two.
2. Okay, I think we do have the umpire. I think so. This one definitely is the wrong answer, which is question number 3. And reverting to question number 2, the umpire, I would like Professor Saab to answer your
I
query.
think there is no doubt that question number 2, the correct answer is C, 153. We are talking about oral glucose tolerance test. Mind it, gestational diabetes is considered very different than all other types of diabetes. The diagnostic criteria and the threshold of diagnosis and the goals are all very different. And this is definitely validated, and the reference answer, the correct answer is more than 153 on OGTT is considered an abnormal test.
Yes, I think so. Very rightly put, because I think the team, you're confusing it with the other form of diabetes and type 2 diabetes. So this is gestational diabetes. It's a different matter that we are discussing. And definitely.
No, sir. Respected sir, we are not confusing the gestational diabetes with other types of diabetes. As per as our knowledge, OGTT, 2 hours OGTT is 140 milligram per deciliter or 7.8 millimole per liter.
Okay, so whatever answer we have here, you forwarded your query, and the umpire is there, and I think everything is backed up by a reference.
Yes, sir.
So I think
Sure,
Professor
sir.
Saab,
They answered 140 B.
Yes, sir.
yes, they answered 153. So which was, can we have it back, the answer?
153 is the correct answer.
Yes, 153, and that was the correct answer.
And they answered which one?
They are
Sir,
saying that it's, can we have it on the screen, technical team? The previous one, question number 2, and the options?
The other team is actually objecting, the team which is asking.
Yes,
that,
the other
No,
team, they are saying that the correct answer should have been 140. I
no,
think
no,
that's
not
what they
at
are
all.
trying to say.
Not at all. Not at all.
So
It
that's
is-
not correct.
We're not talking about fasting sugar. We're talking about glucose after this glucose load. And
Yes.
this is, we're talking about gestational diabetes. And this would, of
yes.
course, be different number if we're talking about a non-pregnant woman or a man.
Yes,
Otherwise, this number is 200. So there's a lot of
Yes.
difference. In gestational diabetes, the threshold is very, very tight, and it is clearly 153.
yes.
Yes. Yes. So I think, you see, as per format, you did convey your query, but we do have a system here. The umpire is there, and we have a review board. But I think in this question, things are very obvious. And if you want, you'll get the reference also. And then I think you
Yeah,
can
I
make the
can
right
give the
corrections.
reference. It is reference by Davidson's.
Yes. So
to
we
the
all
first
know.
edition, page
Yes.
1003.
Very right, sir. So I think there is absolutely no ambiguity there. And
Yes, sir.
now we have to move on to the next question. So we've already had 3 questions coming back to the game.
Yes, sir.
And we have had 2 correct answers, and the third one was a wrong answer. So we are moving to question number 4 now. Please read the question and get your
Question
focus
number
back
4.
on the game.
So question number 4 is, if GDM is diagnosed, what is the initial recommended management strategy? Option A, immediate insulin therapy.
Yeah.
Option B is metformin therapy. Option C is lifestyle modification, including diet and exercise. Option D is oral sulfonylureas. And option E is bariatric surgery.
The timer starts now.
Initial which one? Initial हमेशा initial कौन सा site fairness C करना captain C option C.
Are you sure? You want me
Yes.
to lock C, Charlie?
Yes, lock it.
Okay, they seem to be sure or maybe not so sure. But still, I'm going to lock C, Charlie. Lock C, Charlie. Oh, yes. You were sure. You should have been sure because you got the right answer. Well done. Very well done. And you've got your third correct answer on the fourth question. Well done. With this, we move to question number 5 on your screen now.
Question number 5 is, in women with GDM, which fetal complication is most strongly associated with poor glycemic control? Anencephaly, renal agenesis, macrosomia, fetal growth restriction, and congenital heart block.
60 seconds on your screen.
C लग रहा है ना? C को final कर Anencephaly का उसका ताल्लुक नहीं होता, renal agenesis का होता ही नहीं है, C होता है. Option C again.
Okay, you're sure about it, C, Charlie?
Yes, sir.
Okay, so they are very sure about C, Charlie, and they're trying to play it over the cover boundary for a 6. Let's see whether it's right or false. Lock it, C, Charlie. And yes, this is a wonderful stroke. I would say great understanding, and you came up with the right answer. Good discussion in the end, and very well done. So we are on course. I think it may just get very close in the end, and we are all hoping for such close games. I think we can't forget the last game we had. So wonderful, very well done. So moving to question number 6 now.
Question number 6 is, what is the target fasting blood glucose level in a pregnant woman with GDM? Option A, less than 110 milligram per deciliter. Option B is less than 100 milligram per deciliter. Option C is less than 95 milligram per deciliter. D, less than 90 milligram per deciliter, or option E is less than 85 milligram per deciliter.
60 seconds on your screen, please.
C लग रहा है ना? C लग रहा है.
So this one is a turning delivery by a spinner.
C लग रहा है ना? C लग रहा है ना?
ये है, आप कैप्टन है, आप बोले. आप बोले
क्या लग रहा है आप लोगों को?
Just idea. No idea. Literally.
Approaching 25 seconds.
Yes.
20 seconds now. Come on.
D
Captain,
option.
it seems to be on you now. What is the answer?
D.
D delta.
D delta.
Okay, so they want me to lock D delta. Let's see what happens, because I think one thing is for sure, the team is really honest and they want the captain to take the load on this one. So D delta, lock it. Oh my goodness, the captain was right. Wasn't she? Captain, you should have listened to your own self because you were on the right track. That one you knew, I think. But then again, in the heat of the moment, I think you're a good captain. You were listening to your team. Never mind, that's your second mistake. You still have some room left, but you've got to be very careful now. Need to be more focused, and you still have 4 more questions to go. All right. With this, we move to the next one. Question number 7 on your screen.
Question number 7 is, which of the following oral hypoglycemic agent is considered acceptable for use in pregnancy? Option 1 is metformin. Option B is glibenclamide. Option C, sitagliptin. Option D is pioglitazone. And option D is dapagliflozin.
Okay, your timer starts now. the answering team to wait for the the other team to finish the question, please.
देते हैं भाई metformin. A metformin.
Okay, they've come down the wicket. They really want to go for a big one. Okay, which one?
A metformin.
Are you sure about it?
Yes.
Okay, they want me to lock A. Lock A alpha.
Endo की consult देखी.
Oh, yes. Definitely became an Afridi there. And he's done the Afridi act as well. It's gone for a 6. Well done. Well played. That's a good return. Good comeback with a 6. Well done. Now moving to the question number 8 on your screen.
Number 8, what is the most appropriate time for postpartum screening for the type 2 diabetes in a woman with a prior JDM? At delivery, 6-week postpartum, 3 months postpartum, 1 year postpartum, only if asymptomatic. Symptomatic.
Okay, the timer starts now. 60 seconds.
6 weeks postpartum. 6 weeks postpartum लगता है. 1.5 months है. P4. 1.5.
मतलब 6 weeks सही है ना? 6 weeks सही.
6 weeks.
6 weeks सही है ना? 6 weeks को.
B है ना? सही है?
6 weeks.
B 6 weeks.
Okay, so are you sure you want me to lock B beta? Should I lock it? They are not sure. 15 seconds, come on. Hurry up. 10 seconds.
3 months. 1 year.
8,
1 year.
7.
1 year.
Answer.
1 year.
Come on.
D.
Okay. D delta. Which one?
Delta.
Delta. Umpire, should we take delta, sir?
I think, yes, they said delta within the time. In fact, they will not be allowed to change their mind now.
Okay. Very rightly pointed out. So, within time, you said delta D. Lock D delta then. And let's see. Oh, yes. That is why it was between B and D. It was always between B and D.
Their initial response was 6 weeks. They were whispering 6 weeks many times, and suddenly they changed their mind.
That's why I was wondering it's going to be B. And then they said D. Delta. My God, you were so close to it and yet so far. That's the second question you missed like that.
Although contrary to what Professor Ishaq says that you should take your time, in my opinion, your first response is usually the correct one. Your first thought is usually the correct one.
I believe in that, sir, because it's your reflex action. And I think mostly it's always the correct one, or else you don't know it. So, now the scenario is you're left with 2 questions. You needed to answer all these 3 questions to win it straight away and move ahead. Now you can draw it, and then we have a sudden death scenario. And if you miss another one, then obviously we know that it is going to be the masters moving ahead. All right. So very crucial point. Last 2 questions, extremely important for both the teams. So let's bring question number 9 on the screen.
Question number 9. What is the preferred method for postpartum screening in women with prior JDM? A. HbA1c. B. Fasting insulin. C. 2-hour 75 milligram OGTT. D. Random glucose. And C. C-peptide assay.
Okay, timer 60 seconds on your screen.
Postpartum
With
screening.
prior gestation. 2 hour होगा, 2 hour 75 glucose tolerance test ही होना. यही है स्क्रीनिंग और डायग्नोस्टिक दोनों प्रेगनेंसी में यही होता है.
प्रेगनेंसी नहीं पूछ रहा, वो पोस्टमार्टम.
प्रायर हो चुकी है ना विद प्रायर डीडी.
हाँ,
तो उसमें यही होता है ना, स्क्रीनिंग करो या वो करो, सेम ही है.
तो ये सही बोलना है.
Yes, C option, 2 hour 75 glucose.
Are you sure about it? You want me to lock C, Charlie?
Yes.
Okay, let's lock C, Charlie. And yes, we are going to the last question like this. This is a wonderful stroke, wonderful answer. You got this one right. Very well done, and you are still in the game. So with this, we move to the last question of this second innings. It may not be the last one if you answer it correctly. Oh my God, what are we heading for again? And I can see a big smile on Aziz Saab's face. He knows what I'm talking about. And I think it's going to be really exciting. So let's see and bring the last question of this innings. Question number 10.
Question number 10, which maternal complication is most commonly associated with gestational diabetes? A, preeclampsia, B, placenta previa, C, postpartum hemorrhage, D, deep vein thrombosis, and C is cervical incompetence.
Your timer 60 seconds on your screen.
Pre-eclampsia लग रहा है ना?
C.
Pre-eclampsia लग रहा है ना?
Gestational diabetes is a risk factor for preeclampsia. प्रीविया तो नहीं होता, प्रीविया नहीं होता, postpartum hemorrhage भी नहीं,
हाँ, DVT भी नहीं
नहीं,
हो
cervical
सकता।
incompetence,
Cervical incompetence भी नहीं। Pre-eclampsia ही लग रहा है।
preeclampsia.
Pre-eclampsia ही लग रहा है ना?
Option A, preeclampsia.
Pre-eclampsia ही लग रहा है ना?
So are you sure about it?
Yes.
You've taken this one on the full toss. You're trying to heave it over
We
long
want
on,
to
I
take
would
some
say.
time.
And I think this is either going to be caught or it's going to go over the boundary. Let's see what happens. So I'm going to lock A alpha. You want me to lock it?
Yes, yes.
Lock A alpha. And yes, definitely this one is going for a 6. And you got that one right. So very well played. So yet another, we come to a stage where we are done with both the innings and it's the same score on both the sides. Wow, what a wonderful match again. This goes to show the preparation that they come up with and what brilliant answers we are getting. And it's getting closer and closer. Sir, umpire of the day, and in fact, all the days, your input, sir.
I think definitely both of the teams, they played very well. And we ended up in a draw. As per the format, we will ask one question each team. And then the second question, wherever the decision comes.
Sir, I have a question.
Yeah, please ask.
Sir, there was a question in which it was asked about screening for gestational diabetes. And the answer was 6 weeks at the 6 week during gestation. And I think there was another option of 1 year after postpartum. It is also another screening method.
Yeah. The correct answer was, if you want to screen somebody for diabetes mellitus following GDM, the right time is 6 weeks following parturition. And the right method is OGTT.
Sir, I think you'll have to repeat it again. Did you hear it?
Yeah, the question they're referring to is, what is the right time to screen somebody for type 2 diabetes following GDM?
Yes, yes, sir.
To my opinion, and we have the reference, the right method is oral glucose tolerance test, and the right time is 6 weeks. Although if you wait for 6 months and then go by blood sugar fasting and HbA1c, that would also be okay. But the best one to screen, and screening means that you want to detect the problem as early as possible.
Yes.
So if OGTT is abnormal at 6 weeks, that means this patient has potential type 2 diabetes. Whether or not that patient needs medication, that would be a different question, but that patient is potentially type 2 diabetic patient.
Okay, sir.
Very rightly said, sir, because I think that has the highest sensitivity along with the specificity.
Yeah,
So that's why you have the option.
I think the question said, which is the most sensitive test?
Yes, so I think it's definitely the most sensitive test, and it picks early as opposed to the other modalities. So with this, I think we're now going to move to the second stage.
Sir, I have a question.
Okay, who's
I have a
this
question,
time?
please.
Okay, so services masters. Yes,
Sir,
go
services
ahead.
masters.
Yes.
Sir, regarding question number 2 of gestational diabetes diagnosis 2 or OGTT, the Royal College of Physicians say it is 7.8 millimole per liter 2 or OGTT, which is equivalent to 140 milligram per deciliter. The reference given by Sir, respected sir, is from Davidson, which is also a reference book. बट सर मेरा सवाल यही है कि आरसीपी जो नाइस गाइडलाइंस हैं यूके की हम मोस्ट वही फॉलो करते हैं अगर उनके अंदर ये क्राइटेरिया दिया हुआ है कि 2 और जो है वो 140 मिलीग्राम पर डेसीलीटर के इक्वल होगा, तो हम किसके लिए चलेंगे? मतलब फिर डायग्नोसिस के अंदर हम किसको फॉलो करेंगे, और इस पेपर के अंदर हम किसको फॉलो करेंगे जो हमारा कंटेस्ट अभी हो रहा है?
I think if you allow me to answer, definitely international societies, they agree on 153. In fact, there is Indian Society of Diabetes. They have come up with a slightly higher figure, 155. But 140 would be too tight. Actually, 140, going up to 140 after 75 glucose would be considered normal, even in pregnancy.
Sir, these are according to NICE guidelines. ये NICE
Okay,
की
sir, I
website पे दी
think
हुई हैं।
I think this has been explained in detail, but masters, you have to understand we have a format of the show, and we've always had questions where there has been some discussion, and we always have some data to back it up with, and the references are there. So if needed, you can forward this question. The council is there, and I think
Yeah, I think I'd like to see the reference, a nice guideline reference.
yes, yes. I think that can be reviewed and then they can be notified as well. But as for now, we have to
Yes,
move
thank
on.
you, sir. Thank you.
And we thank you very much. And I know both the teams understand the spirit of the game is there, and we all know that. But I think we all have to stay within the realms of certain restrictions and the regulations that we have. All right. So with this, we now move to the second half. It's going to be a sudden death. And whosoever comes up with the right answer, obviously is going to win. So we'll start with the first team. So who's going to take the question first? Usman, which one is first? I think
Services master?
Dow Elite. Yes.
Services masters.
Okay.
Services masters are also there.
Sorry?
So either of the two teams can go. We can select them randomly as well.
Sir, services masters will answer the question first.
Okay, so we have services masters and they are going to answer first. And can we have the question that we have, and Dow Elite will have to read the question. Okay, bring the question on the screen, please. Dow Elite Warriors, read the question.
Yes. Which of the following therapies improve walking distance in patients with peripheral arterial disease? A. Aspirin. B. Statin. C. Clopidogrel. D. Clostazol. E. Enoxaparin.
And 60 seconds start now. You can unmute yourselves, services masters. Are masters there? Okay, 30 seconds. Are the masters there? I think we have a technical issue there. Maybe we have lost the connection.
Sir, basically they are out. Due to
Okay,
some
they are
error
out. So, okay, they are back again.
They are back again.
Okay, but were they able to get the question there?
They were disconnected. We will give them
Sir,
30 seconds.
we can give some extra time because they were disconnected at that moment.
Sorry, sir, we couldn't get the question, and we haven't got the question yet.
Okay.
Okay, so we'll repeat it. Yes, don't worry. We'll give you full time.
Thank you, sir.
Question is on the screen.
Ji, question is
Okay,
on
do
the
you see
screen,
the question?
Number 11.
Okay, I
Yes,
am
sir.
repeating the question. Which of the
Please
following
repeat the question.
Yes, sir. Which of the following therapies improves walking distance in patients with peripheral arterial disease? A. Aspirin. B.
Sorry to
Statin.
interrupt. Sorry to
Okay.
interrupt. We can't see the question on the screen.
Hold on. Can you pin the question? Technical team, what is the problem there? Please resolve it.
Up mic.
Sir, we are sending screenshot to them.
देख सकते हैं।
Okay, so just let us know when they have the screenshot.
जी, अस्सलाम वालेकुम। जी, मैं screenshot भेज रहा हूँ।
Masters, do you have the screenshot?
No. Not yet, sir.
Okay, just hold on. I think they are bringing it to you.
So if they are not answering, then we can answer it.
No, no, hold on, hold on, hold
For
on.
you, we have
Let's
another
not-
question.
Is he tiger?
we have something else for you.
Maybe to save time, we can ask you the question.
Sir, we got the question. Sorry, sir, we got the question.
Okay. All right. So we are back on. Yes, we are back
Looks like
live.
they got the
have
answer
question.
also.
Okay.
Yes,
So you have the
I'm
question.
reading
Are
it.
you ready for the answer? Should we start the timer?
Yes, sir.
Okay. 60 seconds on your screen now.
वॉकिंग डिस्टेंस और स्लोस्टा जोन सिर्फ वॉकिंग डिस्टेंस की बात हो रही है मतलब क्लोपिडोग्रल
25 seconds.
मतलब ये कुछ एविडेंस इतना पैची है थोड़ा सा उसका स्लोस्टा जोन को लेके क्लोपिडोग्रल ये है कि ओवरऑल वैसे रिकमेंडेड है फॉर द पर्सन सो
15 seconds. Come
सर
on.
वी गॉट द ऑप्शन सी क्लोपिडोग्रल
So you want me to lock C Charlie, right?
यस सर
Okay. Let's see. Lock C Charlie. Oh no! Oh. Definitely the wrong answer. The hint was there. You said it as well. They're only talking about the distance. And what evidence do we have on that? Well. So again, I think a slightly tricky one, but that's what it is. It was quite specific, the question.
यस
But never mind. You guys have actually played very well. And just at the last moment, just at the last, I think, last extent, things went slightly left. But you never know. They can always go right because they have to answer as well. So things can still go right. Rightward or leftward is still something which is left for you. And we see which end we are going when we have the next question coming on our way. So can we have it on the screen, please? Okay, read the question, masters.
So we can't see the question on the screen.
You can't see the question?
Please.
No, we
you
can't see
ask.
the question.
Okay, so can we have the question? Okay, I'll read the question
sir.
for you
Yes,
then.
now we can see the question.
It's gone
You
again.
can see it? Read it then.
No, sir. No, sir,
Okay, you
it's gone
can't see
again.
it? Okay, so I'm going to read it for everyone. Question number 11, that is. Which of the following neonatal complications is most likely to occur in infants born to mothers with poorly controlled gestational diabetes mellitus? Option A, hypercalcemia. Option B, hypoglycemia. Option C, hypothermia. Option D, neonatal sepsis. Option E, polycythemia vera. And the 60 seconds are on your screen now.
Sir, option B, hypoglycemia.
Are you sure about option B?
Yes, sir.
B beta. You want me to lock it?
Yes, for sure.
Okay, he says for sure. This time around, he's very honest. Whenever he's not sure, he doesn't take the responsibility. But when he's sure, he's too sure. Lock B beta and hold your chairs. Lock it and yes! He got this one right. Very well done. And I think it's so amazing to see, so nice to see. Even the services masters are cheering for you. Wonderful. What a wonderful match. What brilliant teams we've had.
No, guys, congratulations.
And I think I'll request services masters to say a few words here. Can we have a few words from them? They are also excited.
Yes, sir. Yes, sir. Congratulations to the guys. It was a very wonderful experience to have being a part of this competition, and we thoroughly enjoyed this competition. So we wish a best of luck to the team from the doors. Thank you.
Thank you very much, Services Masters. It was an honor to have you guys. You guys played it really well. I think for me, everyone is a winner, and you guys are definitely the winners. And moving to Dow Elite Warriors, a couple of words from you. Come on, you can say something.
That was a very informative session for us, and I hope so कि future में भी इस तरह हमसे ये sessions करवाए जाएं. That is a very learning process.
Good, good. So thank you very much. I think it was a wonderful game. आप लोगों ने इसको enjoy किया. आप लोग इस show को show बनाते हैं with your effort. We all enjoy being here. और ये आप सबकी effort है, and I think you are always taking a lot home. Whether it's knowledge, whether it's the way you conduct things, your seniors are there to guide you, and it's victory all around for each and every one of you. So Professor Aziz Saab is there. Sir, final thoughts from you.
Very good match. I just wanted to clarify one thing. Is this Services Masters, the Services Institute of Medical Sciences, Lahore?
Yes, sir. Yes, it is from Lahore.
Yes.
Okay,
Just
that
adjacent
is
to
my
PIC.
alma mater. Actually, I was working there till 2015. I don't think anybody would remember me, but they were very young. Maybe they were students that time. I wish they had won, but I must congratulate the other team, the winning team, the Dow. They did very well. Thank you very much.
Thank you very much, sir. So here we have, I think with this show now, you are going to become affiliated with all the fellows all around Pakistan. That's one thing for sure. And you will be one of the favorites out there because you're always there to support them, guide them. And I think it's, great to have you there. And you're such a support for everyone and each and every one of us also. Thank you so very much for your input, for your great analysis of things, and you're always there to come up with the right answers, the solutions when we need them. And with this, we come to the end. And it was a great game, a great match once again, and a wonderful end in the end, a wonderful conclusion. Both teams were actually right out there fighting it out. And we have a winning team, and we always have a losing team. But I think the losing team is not a losing team. The losing team is also a winner. And for us, Services Masters, they are winners. Just like Dow Elite Warriors, they are also winners, and everybody is winning. But congratulations to all of you. Congratulations to Wilson Pharmaceuticals and PSIM, along with this wonderful Cardiometabolic Premier League. And with this, I think we come to the conclusion. A brilliant game once again. So till next time, I'm going to take my leave, and inshallah, I'll see you next time with the whole team of Pakistan Cardiometabolic Premier League. Allah Hafiz from our end.